I want to thank David very much for that kind introduction. It's a real honor and privilege to be here. The two parts of my job, I don't think of it as a job, I think of it as a privilege, which I enjoy most, are teaching my Doctor of Physical Therapy students. Do we have any PTs in the audience? PT Central over there. Okay, so if you ever need to find a good PT, back there you'll find great PTs. And then the other part of my position, which I love, is talking to people and their caregivers with Parkinson's disease. Many years ago, I went to NIH and proposed my previous phase 2 clinical trial. So when you do research in clinical trials, there are different phases. And a phase 2 study is to show that exercise is feasible at high intensity. And one of the program officers there, a very good friend of mine now, Peter Gilbert, he looked at me and he said, "Daniel, it's just exercise. Why would NIH fund just exercise?" Well, at one level, if you look here, there's Plato and Aristotle. We've known for more than 2,500 years that exercise is good for you. But it is still the case that we don't understand the underlying biology of why exercise is a very, very potent medicine. If we could put exercise into a pill, it would be by far the most potent pill for people. And so it's very good for you, but we don't know why. In addition, Oscar Wilde, and of course we're very close to Dublin here, so I'm quite sure there are a few people with Irish origin, said, "To get back my youth, I would do anything in the world except take exercise, get up early, or be respectable." And so getting out to exercise, it can be quite hard. And you're going to learn a lot today, techniques, support groups, ways to help you do this. Because for many people, it's not easy. But for those of you who talk to people who put lifestyle at the forefront of their life, they will tell you it's a benefit. Now, what I hope you walk away from today is to understand how important progressive resistance exercise is. How many of you do some kind of weight training where you actually lift a load? Hands up high. How many of you don't? Okay, now, I hope to persuade those of you who don't that it is worthy of consideration. You should be doing endurance training 3 times a week and balance training. This will be the exercise prescription. I'm going to show you all the evidence that underlies it. And in different ways, it is needed at all stages of the disease. We have some of you in the room who may have been diagnosed in the past few months, and some of you who may have had the disease for 20 years. So disease duration, age, all affects what you can do, but the underlying common message is you should be doing something. So this is the pyramid. We have resistance to work muscle, bone, and brain. We have cardio to work the heart and the brain. And we have balance, which also works the brain and sensory receptors. And I'm going to go at this point many times. People often ask, do I really have to exercise at high intensity? At the end of the lecture, I'm going to give you a choice. The evidence is clear, but all forms, whether it's focused breathing, progressive muscle relaxation, meditation, is good for one. And many movement disorder specialists like Dr. Hinkle will talk a lot about the mind part. So when you do breathing, meditation, muscle relaxation, it can be very good for you. And for those of you who have a prominent tremor, and if you exercise and it gets a little bit more prominent, then doing some relaxation afterwards to tone down the system. So when you exercise, the system gets excited, and that can trigger a little bit of tremor, which can be a little bit inconvenient. So you then calm down the system. And then at the top end of the pyramid, rowing is great. Cycling is great. I just had a conversation. A cycling program could be bought here. Very good for you. Running is great. Walking is great. Now, for those of you who do not do resistance training, I will tell you exactly what I tell my DPT students. If it is good enough for the squirrel, it is certainly good enough for you. So there's only one take-home message that you get. If it's good enough for the squirrel, it's good enough for you. I've actually put quite a bit of science in the talk. And if I lose you, I'm around all day. I'm not taking off after my lecture. I'll be around all day. Just come and talk to me, and I'll make it a little bit clearer. That green dot is above the number 24. 24 months. And on the y-axis, this is the change in the Unified Parkinson's Disease Rating Scale score. So physicians, like Dr. Hinkle, ask people with Parkinson's disease to move their fingers, to pronate, supinate, to tap their feet. He will pull them from behind. You get a score. And at baseline, the score will be 0, because it's a different score here. And people with the disease progress 3 to 4 points a year on average. So this is disease progression. It's up at about 6. This group here did a gentle stretching program. It was not progressive. They didn't do more weights each time they went in or lift the weights higher every week. They did gentle stretching. And what you'll see at 6 months, they got 6 points better. Their level of Parkinsonism dropped by 6 points. And if you go across every disease, the biggest change you get is doing anything to nothing, because the people I should be talking to, in fact, aren't here today. This is the real problem. They are doing nothing. And the real major challenge of American medicine is to reach out to the people who need to hear this. And so they improved, and at 24 months, so if you look under the number 24, you will see they are right back to where they were at baseline, but they're different. They're below the green dot. And these are the people who did serious weight training. They did 11 exercises of all the major muscle groups, the legs, the back, the arms. And at the end of the study, they were 7 points better off. I have a wonderful video, it was on the national news, of a person who was part of this program, and he is quite convinced it was good for him. The thing that even scientists sometimes struggle with understanding just a little bit is the fact that the best treatment for cognition, the best treatment for your brain currently is resistance training. Now people think, okay, it's May, going to the beach, June, July, let's get to the gym, let's get our muscles in shape. We all know those people. But I want you to know is the amazing effect it has on the brain. So here we have 3 measures. So it's the digit span. How many digits can you remember? Then we have a test of interference. So if you look at one color, does it interfere with looking at another color? And then we have a brief test of attention. And what I want you to notice from this figure, if you look at 24 months, both groups who did exercise, the one group, the progressive resistance exercise training, it's the PRET, the other one is the modified fitness count, they are both above the line. This, in 2015, was voted by the journal Movement Disorders as the paper of the year. Now, why is that? Well, I don't believe what I'm saying next, but unfortunately it's true. I'm actually older than most of you in the room. And so I'm thinking about my cognition all the time. And physicians, when they talk to their patient, think about cognition. And I'm sure most of you, if not all of you, want to keep your cognition. And resistance exercise is very good for it. This is now talking to the PTs and the others of you in the exercise and health profession industry. There is a lot to be said for using devices which make a person unstable. Do I actually have a flashing light here or a pointer I can use? The bottom button. Oh, that's okay. With 2 screens, I can't do that. I'll just walk you through in more detail. Look at the lady doing the half squat, okay? She has an unstable device under her feet. She has an unstable device behind her back, and she will be doing half squats with a light dumbbell. And just think, when she's doing this, all her muscles are being stretched. She's a little bit wobbly. All the muscles are being stretched, and that information is going up to the brain, and that is helping her improve her balance. And so there are 5 exercises here of major muscle groups, and the instability part is well worth considering. And I want you to look under RTIG, which is Research Training Instability Group. There is a test for cognition. It's called the MoCA, which you'll see on the y-axis, the left axis. That's the Montreal Cognitive Assessment. If you are below 26, you have mild cognitive impairment. Look at all those circles below the horizontal black line. These people, before the resistance program exercise, would have been assessed with mild cognitive impairment. And you now go to the line next to them, the triangles, and it's the post-test, and most of them are above the line. There's lots of evidence out there. So the take-home message at this point is I hope to have persuaded you that it was a very wise squirrel and you should do resistance training. Now, why do we do endurance exercise? Well, because the evidence is just overwhelming it's good for you. There have been studies done on primates, and by administering a toxin, they destroy the parts of the brain which have problems in Parkinson's disease. They put the primates on treadmills, and they get so much better. I decided not to show a video of that, but just take it for granted that the evidence for endurance exercise is overwhelming. And what I've showed you on the right side is the importance of making your heart a friend of your brain, and vice versa. So I often get asked the question, well, which one should I do? Resistance? Cardio? Balance? It's a little bit like asking the question, should you only eat protein? Should you only eat fat? Should you only eat carbohydrate? You need it all. You need a balanced diet, and you need a balanced exercise program because the exercise affects different mechanisms. It affects different hormones. It affects different neurotransmitters. So these data are from a phase 2 clinical trial in which I showed that it is feasible for people with Parkinson's disease to exercise at 80 to 85% of their maximal heart rate. I've shown that people with Parkinson's disease will do that 3 to 4 times a week. And if you look again, we have a change score here. If you look under 80 to 85% of maximum heart rate, there was virtually no change. Over 6 months, the disease had not progressed very much. Usual care means people just did what they do. The usual care. Whatever they do, we didn't stop them exercising. That would be unethical. We just let them do what they normally do. And they're about 4 points worse. So when you're a scientist, if you really believe in science, and I do, the single most important thing about science is that if you do a study, somebody can replicate it. Because if you can't replicate a study, then it probably wasn't real. Your data were by chance. And so replication is fundamental to science. I'm going to go through this picture first, and then I'll come back over here. So I'm going to do the talk twice, because this is a very complicated slide. I thought twice about sharing it, but I thought, Columbus, Ohio? They're seriously smart there. So I thought anything less than a seriously clever slide wouldn't do justice to you. So here we have a baseline in 6 months. And here we have the actual UPDRS score. And this group, I've just shown you, it got worse by 4 points. So imagine you're not exercising. Over 6 months, you get worse. And this group stayed flat. Now, I've got a very good set of friends in Holland. For those of you who want to YouTube, some very interesting videos. Main PI there is Dr. Bastian Blum. Bastian and I think identically. In 2019, he followed up with the same finding. Those in a very moderate group, exercise group, progressed. Those in a high-intense group stayed flat. The difference is, I was studying people early in the disease, before they'd taken medication. He was studying people later in the disease, who were taking medication, but we get the same finding. And then in 2021, Dr. Mack in Hong Kong, she showed that with a multimodal, this is doing different exercises, also at high intensity, that in fact, this group actually improved. So at one level, what we really want is stabilization, but if you're working with people who are quite far in the disease, and if they haven't exercised, you can actually do more than just stabilize. You can get an initial improvement. So for this side of the room, so this is my study. Flat at 6 months, no progression. Increased progression. This is the Dutch study, because you could move these up, and they're identical. And then this group, the people actually got better. So the take-home message here is that there are now 3 studies in America, Holland, and Hong Kong, all showing that high-intensity endurance exercise is really good for you. Now I want to give you a true story. So one of the privileges of what I do is I get emails, and I get lots of emails. So this is from Javella, okay? And I was watching an email of one of the I was watching a YouTube this morning of one of the excellent programs available in this area, and there was a 74-year-old lady who was looking just terrific after a very vigorous workout. I'm not sure she's in the room, but if she is, come see me afterwards, because I'm sure you will identify with Jamila. So good morning. I just wanted to reach out and say thank you so much for this study. That's the study I've just shown you, SPARX3. It has fueled me, empowered me, and encouraged me to fight Parkinson's disease like a warrior. That's why we have the warrior princess at the bottom. So at 51, she was diagnosed with Parkinson's disease. She's now 58. Her medication, Azilect, Nupro, and exercise, big italicized letters. I go to work out at least 5 days a week. I celebrated my 1500th class. Mission possible. I remember day one vividly. I was tired, overweight, and stressed to the max. Okay? I was out for dinner last night, and it is also true that people have apathy, they have depression, anxiety. If you have those, you can certainly talk to your physician. One may actually need some medical management, perhaps pharmacological, to help actually with the depression, anxiety, to even get to exercise. But once you do get yourself, it's also been shown that it's helpful for anxiety and depression. So there we have Javella, okay? Whether you look on the left picture or the right picture, I think it's fair to say for her, exercise was transformative. Now I'm going to talk to you about my current phase 3 clinical trial. So in the hierarchy of clinical trials, and you will have read about them for COVID, phase 3 is the top of the pyramid. What you're trying to do is to ask the question, does a treatment work better than another treatment? And then if it does, you hope that it becomes part of best medical practice. There is a site here, a wonderful site here. Dr. Hinkle is the site PI, and Kitra, where is Kitra? Oh, there is Kitra. And Kitra is just, I don't know, not quite sure of the right words. It goes beyond being a privilege to work with. So it's a wonderful site, and people are screened. They have an initial baseline assessment and randomization. So if any of you have not started taking medication and your disease duration is not more than 3 years, and you'd like to meet Dr. Hinkle and Kitra, have a booth outside, and that would be great. And so again, we're comparing 80 to 85% of heart rate max with 60 to 65%. We have blinded assessments and a final assessment. So we have a pre-screen, a screening visit. We also have a dopamine transporter scan. It's a way of looking at your dopamine in the brain. And if one has Parkinson's disease, one has less dopamine binding to neurons. We want to randomize 185 to each treatment arm. Currently, we have 134 people exercising all over America and Canada. We have 25 sites. And then we come to the end. So the intervention is 18 months. It's very tightly controlled. And then we have 6 months where you do what you want, so to speak. It's 4 days a week, 30 minutes at your target heart rate. You're assigned to either 60 or 65 or 80 to 85. You have a heart rate monitor, so we measure the heart rate very carefully. Over on the other side of the screen, this is a device on an app which tells you whether you are or are not working out in your appropriate heart rate. And so that's as much as I'm going to say about SPARX3 today, because those results are still to come. Now, so far in my talk, I've given a fairly hard push for the exercise prescription, and I'm going to come back to that. But I am 100% aware that there's a very potent social side to exercise, and there's a very important aspect of really enjoying it. And at the end of the day, each person has to decide what is best for them. Now, cycling is terrific. Jay Alberts has done wonderful cycling stories, and for those who cycle, it's great. I can tell you, I cycle in a group, and I love being part of that group. So on a Saturday morning, when I'm not here, I will be out with a group of 60 people. And yes, why do we cycle? Well, when you've just burnt up 1,500 calories, you can go and eat whatever you want afterwards. And so there's a social aspect to everything. I love aqua aerobics. If you've got arthritis, if you're having joint problems, if you're prone to fall over, well, the worst thing that happens with aqua aerobics, you fall, wet your hair, and you've got to redo your hair. But that, in the grand scheme of things, doesn't seem to be too bad. Move big is great. Dancing is terrific. The work on tango is very good. And I love rock steady boxing. The reason I don't study these, because sometimes people ask this, is I can't quantify the dose. So my studies, we are very careful to quantify the dose, what rate the heart is beating, what weight is being lifted, so eventually we can attribute the dose to the underlying mechanism, because we really want to understand how exercise works. But I can tell you, in terms of group events, camaraderie, and we have some great programs around here. I mean, you look at this picture, and you've got a group of people taking ownership of their disease. They're not staying home popping pills. They're out. Ownership of their disease. And I think it's a fantastic picture. This paper is from New England Journal of Medicine. All I want you to realize is, for some people, the slow, graceful, mind-body relationship activity of Tai Chi is very beneficial. And so, for those of you, treadmill may not be your cup of tea, elliptical may not be your cup of tea, I haven't persuaded you how clever the squirrel is, there's Tai Chi. So this is the exercise prescription, and it's clear. Some form of resistance training twice a week, endurance training 3 times a week, and balance training 1 to 2 times per week. So what is the prescription to help your Parkinson's disease? Take 1 aspirin every day, take it out for a run or on your treadmill, then take it to the gym, then take it to a Tai Chi class, and then take it to all the great programs you have around here. In some parts of America, one can say, I've just got no support. And you can't say that in Ohio, and you certainly can't say it in Columbus. Now, the good news is, outside, by the way, do we have our 2 representatives from the Parkinson Foundation? Are they out manning the booth, or are they in here? I think they're working hard outside. They have this documentation. So the Parkinson Foundation has worked very, very hard to provide relatively simple literature like this, and I think one lady there is already picking up hers. And what you can see is aerobic, strength, balance, agility, and multitasking and flexibility. They have the brochure outside, and this is very much evidence-based. They also have this. And one of the privileges of working with people with Parkinson's disease is that many of them become ambassadors to reach out to other people. I was actually involved in developing this picture, so I work very closely with Parkinson Foundation. And the idea here was to make it simple that you can give it to somebody. If you run into a person with Parkinson's disease, this is relatively straightforward. And we're trying more and more to develop literature that is simple, clear, and straightforward. Now, this is the challenge, and if anybody ever solves this challenge, they should get, the equivalent of a Nobel Prize, because whatever people have solved to get a Nobel Prize is complicated, but getting people to exercise is a much larger problem. So if you get a Nobel Prize in physics, it's just solving equations, difficult equations, and only very few people can solve them, but we don't know the equation to get people to exercise. Now, there are many options, and they're different for different people. So there's physical therapy. Here, the way the movement disorder program practices physical therapy, access to physical therapy is available on diagnosis, which is best, because PTs can get a snapshot of your physical function and track it over time. Movement disorder specialists, gifted as they are, don't track function. They don't have time, and they've got too many other things to do. And so seeing a physical therapist regularly is good. Individual training, personal trainers is terrific. It's expensive, and so it doesn't really work for a lot of people. And also, it's not group training, but it's terrific. Group training works very well because people like the social camaraderie of being around people. I've done a lot of work out in the community when you're dealing with, for example, frail elderly people, that you can train caregivers to do simple exercises. So if you're with a very frail elderly person and they have a caregiver coming in, you can train them to do that. So there are ways of doing exercise intervention or activity at multiple levels. Dyad training is training in pairs. Sometimes it may be nice to get on a treadmill and have one of your friends next to you. I mention the treadmill because walking in Chicago outdoors in the middle of January when it's minus 50 with a wind chill, not recommended. And then we're going to have in the room people who are really love the technology. They love their heart rate monitors, they love Strava, they love all of these different options. And so if you go on the internet, there's Zwift Insider, Strava.com, Facebook. I've got here Twitchy Woman. I talked at length with Dr. Hinkle last night. She is a person with Parkinson's disease in California, and she runs a group for women only, meets on Sunday mornings, and she invites people to talk and discuss a whole myriad of issues. Some people prefer groups with males and females. Other people prefer sometimes women only. At the end of the day, the important thing is to find what works for you. And then to come back to Oscar Wilde, to love oneself is the beginning of a lifelong romance. And I'm quite sure that if Oscar was with us today, he would probably realize that perhaps he would like exercise, because I think he did like himself. I Zoom every month with a group of people with Parkinson's disease because I can answer their questions, and I learn a lot about the disease from listening to them. And they sent me a Kudo board last Thanksgiving, and this is just 3 of the people. And the take-home message of this slide is, depending on your age and disease severity, I realize I'm talking to a very wide audience here. This may not apply to everybody, But at least for these people and most people, one can still lead a very active, healthy life. Now, who to listen to? I gave a talk to Australia a couple of weeks ago to a group of people, and they're PD warrior in Australia. And I started off pushing hard the enjoyment part, the friendship part, doing it lifestyle, and I did not push the prescription until halfway into the talk, because I understand the key thing is for people to find something they will do throughout their life. And I got this wonderful email back from David Blacker. Now, he's one of those very rare people who is a neurologist who sees people with Parkinson's disease and has Parkinson's disease. So I can stand up here and lecture. I've got a sense of what the disease is, but I don't have it. He does. I will be having a nice beer with him in Barcelona at the 6th World Congress, where lots of people with Parkinson's disease go. So if you've never heard about the World Congress, it's a chance for people with the disease to sit at tables just like this with people just like me, because I'll be giving a presentation there, and they can talk. And so he says, while superficially I agree with the enthusiasm behind comments like exercise is medicine, do exercise you like, any amount of exercise is good, I have a concern that this devalues exercise as an intervention and is akin to me saying to a patient, take whichever one of these medicines you like, 50 mg, 200 mg, once a week. So I do hope that I've persuaded some of you to really think about doing high-intensity endurance, resistance, and balance in a very structured way, because the evidence is clear-cut. For those of you in the health professions, for those of you who, actually we have Jim Kroger in the room. Jim, where are you? So we have Jim at the back. So how many gyms do you own at the moment? So he has 3 clubs. So we have people here in the health professions. I wrote chapter 11. I rewrote and brought it up to date, chapter 11 in the ACSM guidelines for exercise testing and prescription. And in it, for those of you interested, is all the details behind the best exercise prescription. It's hard going, so my first port of call would be outside the Parkinson's Disease Foundation. And I just want to finish, or getting close to finishing, by pointing out that this is actually the same thing you would get from the CDC, from National Institute of Aging. So for those of you who do not have Parkinson's disease, it's really good for you too. And one thing I really want to push hard is the idea of living healthily with Parkinson's disease. And it's not an oxymoron, okay? You can still have a healthy lifestyle and be healthy with the disease. And the clearest example of the benefits of being in great shape comes straight from COVID-19. So if you're in great shape and you got COVID-19, you may have died, but it was a small number. And if you were in really bad shape with lots of high inflammation and everything else, your risk factors are really quite different. And so the idea of being healthy is important. My good friend Jose Obeso, who's a world-famous neurologist, when he first sees a person with a disease, says, we're going to talk about getting you healthy first. And then we're going to worry about your Parkinson's disease. I've got a colleague in Colorado who's got a quote in an upcoming book. When she prescribes medicine, she tells the person, The purpose of the medicine is to help you exercise. It's turning things a little bit upside down. By the way, I put this slide in at the end because I know one thing, okay? You may have not liked any part of my talk, but I guarantee there is nobody in the room who doesn't like Tucker. So this is Tucker at 4 months. Tucker is now 2 years old, and Tucker's doing very well. Thank you very much for your time and attention.